To say that healthcare is complex in the United States would be an understatement. We have third-party payers, we have this insurance game, and not much of this direct payment by consumers to physicians or medical practices for their services. Consequently, we have third-party payers interfering with the physician-patient relationship. Every single year, there's a struggle by the United States Congress to balance the budget and also set rates, believe it or not, payment to physicians by the Medicare system, the largest payer in the United States, is set by Congress every single year. There's a formula that is used in a conversion factor. So everything that we do is tied to a something called a relative value unit. We are actually rated and given a value for every service that we provide, believe it or not. And that value is translated into relative value units, RVUs. That is multiplied by a conversion factor. And that conversion factor multiplied by RVU gives us the dollar amount that physicians are being paid. So every single year, this is being adjusted. And this year, in 2023, so the changes are proposed, and then the final rule comes out around November, and then January 1st of the following year, in January 1st, 2023, in a couple of weeks, the rates are going to take a drastic decrease for physicians. Now, this is nothing new. This is nothing new. In the past, about 10 years ago, we had something called the Sustainable Growth Rate, SGR, and Congress has kicked the can down the road every single year so that every year is a struggle, is a looming, impending doom by medical practices. Are we going to be taking a 20% decrease? Are we going to be getting a 20+% decrease by the end of this SGR mess? When everyone wanted to convert out of the SGR mess, I said, this is going to be just the same thing, a bad idea. And sure enough, for a couple of years, everyone thought, hey, this is working out great. The physicians, medical practices, this is going to work out great. Well, look at where we are now. As it sits, starting January 1st, 2023, medical practices who accept Medicare as payment, which is most of the medical practices in the United States, are going to take a drastic decrease in payment. We're talking 8.5% decrease just on the conversion factor alone. And remember, RVU times conversion factor equals payment. So an 8.5% decrease in payment, just straight off the bat. Not to mention a 2% decrease that's already taken place, something called sequestration. See, I told you this is going to be crazy complicated healthcare. So healthcare payment is no different. It's complicated. We're already taking a 2%. We already took a 2% decrease this year, starting July 1st. Starting January 1st, 2023, we are all going to be taking an 8.5% decrease. Further, not even taking into account the 9-point-some-odd% inflation that we are seeing. Yeah, that's right. You're thinking, what? 8.5 plus inflation? Yeah, it's going to be bad. It's going to be bad. So there's a medical, I guess, a society called the Medical Group Management Association, membership by paying a due, and they advocate for patients, advocate for medical practices to make sure they are running a sustainable practice. They do a lot of surveys, and one of the surveys that they did recently just came out, was just released, and I'm going to go over some of the results with you here. And this is a MGMA survey that was just conducted, a survey of 517 medical group practices ranging from small single provider practices to large 2,400 physician health systems across 45 different states. 45 different states. Yes, that is correct. So what did they find? They found that according to 92% of the survey groups, Medicare rates in 2023, before they projected an 8.5% cut that will take effect, they already are inadequately covered. The payment already inadequately covered the cost of furnishing care. So you look over here, 92% Medicare payment in 2022 does not adequately cover the cost of care provided. So what are they going to do if they are facing another 8.5% decrease on January 1st, 2023? Stay tuned till the end. I'm going to show you how you can combat this both as a patient and also as a healthcare provider. So to offset the reductions in payment, groups of all sizes are considering what business decisions must be made to ensure the financial solvency of their practices. And I've said this in my presentation to physicians, to medical managers across the world, across the country, that your patient's success depends on your success. Your patient's success depends on your success. What I'm saying is that if you don't run your practices successfully, you will not be able to keep the lights on. You will not be able to pay your employees. You will not be able to pay rent. So if you're not running a successful practice, you will not have the privilege to take care of your patients. That's what this means. So what are some of the changes that are going to be taking place by these medical practices across 45 states, 517 medical practices? 58% are considering limiting the number of new Medicare patients. Limiting the number of new Medicare patients, which means if you're not already an existing patient or if you don't age into it. So this is what I found interesting many years ago when I started practice, probably, close to 20 years ago. I went around and asked primary care doctors about how they practice medicine. And this is like 20 years ago. One of the practices said that unless you age into Medicare with us, meaning you are like, say, 64, 63, and you're already an existing patient, and then you turn 65, you get into Medicare, unless that happens to you and you're already an existing patient, we're not going to see you because we simply don't have the capacity to take such low payments from Medicare. And starting next year, it's going to be even lower. So it is not a sustainable way to run a business. And this is 20 years ago. Primary care doctor practice is already doing that. And now, among these 517 medical practices surveyed, they're saying 58% of these people are considering limiting the number of new Medicare patients. So if you don't already participate or are not already an existing patient, they're probably not going to see you. And that's what I'm doing right now, as a matter of fact, for one of my private payers. They're the worst payer in Arizona, and I no longer take any new patients from that particular payer because of the administrative burden, the amount of work that my staff has to put in to see one of their patients. I have limited capacity, and time is an inelastic asset that you cannot buy more of. Every one of us have 1,440 minutes a day. And when I have a payer that's going to waste my staff's time so I can take care of the patients, and it limits my capacity to take care of other patients, unfortunately, I'm going to have to make a decision and not see those patients. So 58% of the practices surveyed say that they are going to consider limiting the number of new Medicare patients. That's the impact of the decision by Congress starting January 1st, 2023. 66% of those surveyed are considering reducing charity care. Now, it's interesting. These are private practices. And when we take care of patients for free, that is not a write-off. Unlike hospital systems where they can write off the charity care that they provide, private practices do not have the luxury. We don't have the ability to write off and benefit from the taxes from the top line when we provide charity care. So 66% are considering reducing charity care. 58% are considering reducing the number of clinical staff, meaning less employees to take care of patients. 29% are considering closing satellite locations, making it more difficult for Americans to seek care. And I'm going to read some of the responses from just Arizona. One administrator said, "We would be forced to limit new Medicare, Medicaid, and Medicare, I call them disadvantaged patients. We would aggressively pursue increases to our commercial plans." Good luck with that. "Most that already own Advantage and Medicaid lines of business." the decreased reimbursement with a simultaneous increase in administrative burdens and the overall inflation is simply not sustainable. And this is coming from an administrator that runs a 60-physician general surgery practice in urban Arizona. Here's another response. It will require us to reduce staff that serve the Medicare population and the complexities of providing their care. It will require us to reduce support for participation in the Medicare Shared Savings Program and other incentive programs. It will require us to focus on other patient populations and reduce our Medicare population. This is coming from a 2-physician family practice in urban Arizona. So congressional decisions have impacts on your health care and your life. So I'm going to urge you to take action at the end of this video. Okay, let's get back to it. Next comment. With the current market for jobs in our area, we struggle with keeping up with the rising pay scales to keep staff before any reductions in payment. I'm not sure how we would be able to be competitive in this market if we were to see a continued drop in reimbursement. And this is from an 18-physician oncology practice in urban Arizona. Imagine having cancer and imagine having Medicare as your payer. Imagine not being able to get appropriate and timely health care when you have cancer in your greatest time of need. Elections have consequences. Congressional decisions have consequences, and this time, it might be your life. All right, next comment by another medical practice. We would be forced out of business. Hard stop, period. Then this comes from a 3-physician cardiac thoracic surgery practice in urban Arizona. And I will put the link to this report by Medical Group Management Association in the comments if you're interested in reading. And here is my call to action for all of you. There's only one way to effect change in this situation, and that is to have our congressional members make the wise decision to stop these cuts, because it's going to impact literally on your lives, literally on your lives. This is something that happens every single year. I've been dealing with this for almost 20 years. Something that happens in the background, but nobody talks about this dirty laundry, the dirty business of healthcare politics, but it is literally your lives at stake. And I highly encourage you to write your congressional members, and I will, again, put the link in the comment section. It's very, very easy. For me, in Arizona, in my district, I have Andy Biggs. I've already written to him. And I also have Kirsten Sinema and also Mark Kelly as my senators. I've already written to them, too, about this crazy decrease in payment to physicians starting January 1st, 2023, that will literally harm Americans in limiting their ability to seek health care. I don't know how else to put this, but your lives are depending on it, and I highly encourage you to contact your congressional members. I will put the link in the video description. You simply click on the link and write an email, call your congressional members, urge them to fix this problem. And don't be surprised if the problem gets fixed and the can gets kicked down the road for a year or 2 years, because the number one job of these congressional members is to be reelected. Be reelected. And I'm highly in favor of term limits so that it would force these congressional members to do the right thing instead of doing whatever it takes to get them reelected. So anyway, the call to action is to contact your congressional leaders and talk about this impending, or actually currently the legislated decrease of 8.5% to medical practices that will impact on your ability to get the care that you deserve. Lastly, as always, take care of yourself, take care of each other, and thank you for the privilege of your time. Bye-bye.